Hi, Freedom Lovers. This is Dr. Peterson Pierre with America's Frontline Doctors, bringing you today's Daily Dose. So, a bombshell study that the Lancet pulled within 24 hours is finally seeing the light of day. Now published in the peer-reviewed Forensic Science International journal, the systematic review of autopsy findings in deaths after COVID-19 shots revealed a whopping 73.9%, quote, were directly due to or significantly contributed to, end quote, by the injections. Canadian oncologist and cancer researcher Dr. William Mackis posted on X, quote, "This is a victory of science over censorship. Incredible perseverance by first author Nicholas Hulscher, who didn't give up after Lancet pulled our paper within 24 hours after hundreds of thousands of downloads for no legitimate reason. Big Pharma put the squeeze on the Lancet, but has failed to stop us. Our paper was delayed by 1 year, and those actions of censorship and cancellation led to many deaths that could have been prevented. This paper could be a game changer," end quote. Researchers including Mackis, cardiologist Dr. Peter McCullough, and Nicholas Hulscher, an epidemiologist with the University of Michigan School of Public Health, searched for all published autopsy and necropsy reports relating to COVID-19 shots through May 18th of 2023. Their systematic review included 44 papers with 325 autopsy cases and 1 necropsy case, which is an autopsy performed on an animal. The average age of the people in these reports was 70.4 years. Most often, the cardiovascular system was involved in the death, followed by blood problems and respiratory issues. In 21 of the cases, 3 or more organ systems were involved. The mean time from the shots to death was 14.3 days, but most deaths occurred within a week of the last shot. 3 doctors who are experts in figuring out causes of death and studying diseases looked at each case separately. They carefully examined all the information available for each person who died and concluded that in 73.9% of the cases, COVID-19 shots either directly caused or played a significant role in the person's death. Quote, "The consistency seen among cases in this review with known COVID-19 vaccine mechanisms of injury and death, coupled with autopsy confirmation by physician adjudication, suggests there is a high likelihood of a causal link between COVID-19 vaccines and death," end quote, the researchers concluded. Of course, not surprisingly, because we know medicine is compromised, the Lancet almost immediately pulled a concerning study. The journal stated, quote, "This preprint has been removed by preprints with the Lancet because the study's conclusions are not supported by the study methodology. Preprints with the Lancet reserves the right to remove a paper that has been posted if we determine that it has violated our screening criteria," end quote. As noted by the Daily Skeptic on July 6 of 2023, quote, "Without further detail from the preprints with the Lancet staff who removed the paper, it is hard to know what substance the claim that the conclusions are not supported by the methodology really has. A number of the authors of the paper are at the top of their fields, so it's hard to imagine that the methodology of their review was really so poor that it warranted removal at initial screening rather than being subject to full critical appraisal. It smacks instead of raw censorship of a paper that failed to toe the official line. Keep in mind that the CDC has not yet acknowledged a single death being caused by the COVID mRNA vaccines. Autopsy evidence demonstrating otherwise is clearly not what the U.S. public health establishment wants to hear, end quote. The censored paper has now been peer-reviewed, however, and its findings add further support to those who have been sounding the alarm about COVID-19 shot dangers all along. The researchers explain, quote, "We found by independent adjudication that 73.9% of deaths were attributable to fatal COVID-19 vaccine injury syndromes." Adding, "These results corroborate known COVID-19 vaccine-induced syndromes and show significant temporal associations between COVID-19 vaccination and death involving multiple organ systems, with a predominant implication of the cardiovascular and hematological systems. Criteria of causality from an epidemiological perspective have been met, including biological plausibility, temporal association, internal and external validity, coherence, analogy, and reproducibility with each successive case report of death after COVID-19 vaccination, combined with population-based studies describing mortality among the vaccinated. Our findings amplify concerns regarding COVID-19 vaccine adverse events and their mechanisms," end quote. Now, to answer the question of why the Lancet pulled the paper so quickly, the Vigilant Fox said, quote, "Another COVID conspiracy theory becomes reality as a bombshell study censored by the Lancet has now been peer-reviewed. What were they trying to hide, you ask? Lots and lots of vaccine deaths," end quote. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.